Okay, good morning, good afternoon, good evening to anyone who has joined this University of Hampton London online event. Welcome. Today we have a very, very special panel of MPH students slash graduates. They're still waiting to hear back on their final dissertation, but nonetheless very experienced and very informed students on the public health of their own countries. And this is what we're going to talk about today. We're going to have a big overview on different public health systems from across the world. We're going to talk about Austria, going to talk about Qatar, and we're going to talk about Kyrgyzstan's public health systems, how they work, what are their challenges, what are their good points and strong points, and of course, some of the other insights that our panelists are going to give us about these systems. So without further ado, let's get into it. I'm going to present our lovely panelists for today. So we have Maeve all the way from Ireland at this moment, but she is going to talk about Qatar. We have Nagira from Kyrgyzstan, and we have Florian from Austria. So welcome everyone. I'm going to ask you for about 1 or 2 minutes to shortly present who you are, what you're doing, and of course, why are you doing the things that you're doing right now. So Maeve, let's start it with you.
Hi, good afternoon, everyone. Apologies that you cannot see me. It's a technical issue. So as Michael very kindly introduced us there, my name is Maeve. I am originally from Ireland, but at the moment I am based in Qatar in the Middle East. I am a radiation oncology therapist. Basically, I'm involved in the radiotherapy aspect of cancer care. You're probably quite familiar with chemo, but radiotherapy is also a very common treatment for cancer. So I'm involved in the planning, I'm involved in administering the treatment and basically the overall care of the patient. My educational background is I have a Bachelor of Science in Radiation Therapy, which I received in Ireland. I worked postgraduate for 5 years in Ireland before relocating to the Middle East. So I've been here since 2011, and it is you'll hear later on during the course of our webinar about life in the Middle East, basically from a healthcare point of view, but it's been a wonderful experience. It's given me a good opportunity to travel, which I'm doing lots of. And in my spare time, I enjoy exercise, CrossFit, enjoy good food, and definitely travel would be one of my big passions. So I'm looking forward to this webinar and all of your questions.
Thank you so much. Nagira, can we have your...
Hello. Yes, sure. Hello, everyone. I would say good evening, good morning, good evening, and good day. My name is Nagira, and I am from the Kyrgyz Republic and based in the Kyrgyz Republic. I work for the International Committee of the Red Cross as a laboratory technician. So we are mainly supporting the National Tuberculosis Program in the prison system. And my medical background. So I studied in Germany nursing for 3 years. So in general, I lived in Germany for 6 years. And then I returned back to my country. And then I continued studying Master of Public Health at the University of Roehampton. And at my free time, I like inline skating, jogging, reading, and dancing.
Wonderful, wonderful. Thank you so much, Nagira.
You're welcome.
Okay, last but not least, we have Florian. Hi, Florian. Can you tell us a bit about yourself?
Hi there. Yeah, my name is Florian. I am from Austria, and actually I am the assistant of a medical director in a rural hospital here. But actually I'm changing a bit my visions and my way because, again, because there is a new project coming up that we are setting up a health region outside here around the hospital, where we try to connect each other, especially healthcare professionals. Yeah, and this will be the next thing I'll do. For my educational background, well, I guess I can call myself a little bit of an edupreneur because I studied medicine. I'm an accomplished author and science journalist. I had a magazine. I studied medicine for a couple of years. Then yeah, I did a diploma in project management. Then my master of public health at Roehampton, and actually I'm moving forward for a Master of Science in Environmental Building Design at Cardiff University, and then going for my PhD. Yeah, so love learning and reading. That are my hobbies, and occasionally jogging.
Oh, thank you so much.
And,
soon to be father as well.
Yeah, and soon to be father. I hope not right now, but okay.
Okay, that is wonderful to hear. My name is Michael, and I will be the moderator for this conversation. We have 7 topics for today to cover, so a bit of the house rules. What we're going to do is that in the next 30 to 35 minutes, we will manage to cover these 7 topics, looking at the different health systems from these 3 experts representing the countries that they work in. And then we will open up the panel for another 10 minutes for you guys to put your questions and to address your questions directly to the panelists. So it is a perfect opportunity for you to take notes, to listen to the different systems that are presented here, to compare to what you're learning and what you're actually maybe researching yourself, and to also ask the questions that you want to ask. So this is also the purpose of today's panel, to make sure that you engage and you get informed. Good. And then another small mention, if you want to know a bit more about our panelists, there is in the handout section a document called Short Bios. So all of the 3 bios are presented there. Download it as soon as the conversation is over if you have more in-depth curiosities about who they are and where they come. Perfect. Now with all of these being settled, let's dive into the conversation. And we have the first topic that we're going to discuss, and that is demographics. And the question is, what is the demographic structure of each of the countries that you guys represent? And especially, what is the predicted demographic structure for the next 10 to 20 years? And we're going to start off with Nagira. So Nagira, what is the demographic structure of Kyrgyzstan?
So the population in the Kyrgyz Republic is rising steadily, and for today we have approximately 6,034,000 population, and with a growth rate of 1.09%. And the future demographic of the country, it will rise. It will rise, and if we go to 2020, the population will be 6,384,000 approximately, and the age from 55 to 60 will also rise compared to today's. Yeah.
That's quite interesting, and it's quite a small population considering the size of the country.
Yeah, the Kyrgyz Republic is quite young country and quite small country, but still the population is rising very steadily.
Okay. And what about Austria, Florian? What's the demographics there?
Austria, it's vice versa to Kyrgyzstan. We have 8.5 million people right now. And the biggest challenge will be up from 22, 25 on, that there will be more people over 60, 65 years old than those who are occupationally working and earning money between the ages of 20 to 40. So Austria is an aging and over-aging federal republic with a big problem getting youngsters and young people into the country from outside, and we have also problems with the birthing numbers in the last years. So yeah, vice versa to Kyrgyzstan, we are an old and over-aging country right now.
Okay, that is quite interesting. And what about Qatar, Maeve? What is happening in Qatar in terms of population?
Qatar is actually quite interesting. So it's a very, very small Gulf state. At the moment, the population lies at about 2.6 million, but of this population, only 12% are Qatari nationals. The rest are all expat workers. So the population is largely the expat force. As a result, the age structure is quite skewed. Well, it's quite young. 70, about 76% of the population are aged between 15 and 64. So only about 1% of the population are over 65. And it's a result of two things, because only 12% of the population are Qatari nationals. And when you are 60, that is the retirement age, and expats will retire and they will return home. Like, you do not stay to retire in Qatar. So it's quite in contrast to Flow in that the population is young, and even as the population increases, it's due to rise from 2.6 to 3.7 million by 2030. But that age structure, it probably will not change at all, because the increase is going to be due to the influx of foreign workers. So that is so it's a young population and largely expat, but increasing exponentially due to net migration, with all of the World Cup projects and basically all of the money that's being pumped into the country for development. There just simply isn't enough Qatari nationals to help with the development. So they will rely on foreign workers, but the population will remain, age structure quite similar.
So such an interesting mix of countries, a big country that is small in population but growing, quite old country that is getting older and older, and a very, very dependent on expat countries. Okay, so let's see, in terms of funding, how is the healthcare system for each of these countries funded? Where does the money come from? And let's start with Austria. Florian, how is the health system funded in Austria?
Well, Austria as one of the members of the European Union, and as one of the richest countries in the world, relies on funding possibilities via the government on the one side. On the other side, there are plenty of private funding possibilities, and throughout congregations like the Catholic Church. Actually, the system works like this: that Austrian people pay for national insurance into a national insurance system, and then they get treatments, etc., at ordinations, private practices, etc. The government pays for the hospitals, and here is one of the big problems in Austria, because the government pays for the hospitals and the insurance system pays for the private patients and the patients themselves. There is a discrepancy, because there are two pots, so to speak, where people and where the system is paid from, and if there are problems between those two systems, nothing is moving forward. Things are stabilized, but are also somewhat in a solid state. So the funding system per se works fine. Up to 98% of all Austrian people have an insurance. So if you have a medical problem, then you get medical treatment within 10 to 15 minutes. It's absolutely, it's really marvelous and working perfectly fine. However, it is also a very stable and overcautious system, in the sense of, don't change anything. Everything is fine right as it is, even if we have to spend more and more money each year for it.
Okay, thank you so much for that, Florian. And what about Qatar, Maeve? What is the funding distribution in Qatar?
Well, as you're probably all quite aware that Qatar has huge oil and gas reserves that were discovered in the 40s and 50s. And from the 60s onwards, these resources were really exploited. And the former emir and his wife, Sheikha Moza, she's quite a public figure. You may be familiar with her. They put healthcare at the top of their priorities. So there was huge billions invested in healthcare. and the aim was to provide universal healthcare for everyone, citizens and non-citizens. So that was very ambitious, and it did work for a long time. Healthcare was entirely free, but in 1999 they introduced a health card which only cost $25 to $30, and from then on, for Qataris, healthcare remained free, but for expats, it's heavily subsidized, but there is still some out-of-pocket payment requirements just to offset like the rising population and rising costs. So for the most part, it's still free. 70% to 80% of healthcare is public health, and then 20% is provided by the private sector. But the government is trying to encourage the private sector to play a bigger role just to help them offset the costs, because obviously they're spiraling with a spiraling population in a healthcare system that is still largely free to the public.
And those $30 to $40 are per year or per month that they have to pay?
Per year, so it's very nominal. And even with that, a subsidized, like a course of antibiotics, for example, is so subsidized, it would only cost you about $1.50. So it's still very, very heavily subsidized.
Okay, and I'm guessing that situations are not so pink in Kyrgyzstan. What's the situation there?
The situation in Kyrgyzstan. So, as I already told, Kyrgyzstan is a very young country. It's a former Soviet country. After the collapse of the Soviet Union, Kyrgyzstan faced a very, very difficult time, financial and economic crisis, and there were a lot of unofficial payments. The rate of the unofficial payments was rising very high. So, starting from 1999. The government and the Ministry of Health, with the support of the external donors and World Health Organization, they started to create kind of national health reform program. And one of the aim of the national health reform program was improving the financial system of the healthcare system. And actually, the financing of the healthcare is coming from three sources: is a private source, is a public source, and then external funds. Private is out-of-pocket payment, so patients, they pay from themselves, and the public payment comes from the tax revenues, and the external is from international organizations. So nowadays, until now, we are still depending from donors and international organizations.
Okay.
Yes.
Very, very interesting and very diverse, right? Okay, let's focus now a bit on how the healthcare system is educated. So the question here would be, how do you become a doctor, nurse, or a public health specialist in your country? How are healthcare professionals trained and accredited? And let's start with Maeve for this question.
Sheikh Moza, part of her vision was to create a world-class education system to go with a world-class healthcare system. So, and to stop becoming so reliant on foreign workers. At the moment, 90% of the public healthcare workforce are actually foreign workers. So at the moment, there is Weill Cornell. They're an American university. They have a campus in Doha, and they offer a pre-medical course and a 4-year medical degree program. And Hamad Medical Corporation, the main public health organization, have a arrangement with this college to provide specialist training. In terms of nursing, there is a diploma and a degree program offered at Calgary University, and allied healthcare professionals receive training at College of the North Atlantic, Qatar. This is a subsidiary of the campus in Newfoundland in Canada. So that would be they offer radiography, they offer dietetics, and they offer dental assistance. So they still have a lot to do, a lot of work to do to create some homegrown public health professionals, and there need to increase the interest among the Qatari nationals in occupations such as allied healthcare professionals and nursing, because the working conditions aren't very attractive. Shift work, it's still kind of like viewed as, you know, menial labor. So there is always big drives to try and change the point of view and to encourage more locals to enter these professions. So that would be a big aim for Qatar moving forward, to become less reliant on foreign workers.
Okay, interesting, very interesting. And what about Kyrgyzstan, Nagira? What is how are doctors and nurses and healthcare specialists educated there?
So, for in terms of doctors, if they want to become a doctor, they have to study for 6 years, and then they get a medical diploma. After getting the medical diploma, they go for the internship. Internship may last from 2 to 4 years, depending on the chosen specialty. There are three main medical institutions: Kyrgyz State Medical Academy, Kyrgyz Russian Slovenic University, and Osh State University, where the doctors are studying for 6 years and then they go to the internship. If they want to improve further, if they want to study further, then they go further to the aspirantura, which lasts 2 years. So they then can start working on their thesis. And only after aspirantura they can go for the award of doctor, to get an academic doctor. Yes. And for the nurses, and almost in each oblast in the Kyrgyz Republic, there are medical colleges, and nurses are studied in the medical college for 3 years. After 3 years, they can become a nurse or nurse and midwifery practitioner.
And just out of your knowledge, do you know if there's a lot of expats coming to learn and practice medicine in Kyrgyzstan?
Yes, we have a lot of students from India, particularly from Pakistan, who are studying in Kyrgyzstan. They study this 6th year to get a medical diploma, and in Kyrgyzstan there is one medical institute which is only for foreign students, and also in one university there is a medical department which is also for the foreign students. But also in the Kyrgyz State Medical Academy, foreign students can study and then get a medical diploma. And then for the internship, for further development, they go back to their country and then
and practice there.
They do in practice there, yes.
Okay. And what about Austria, Florian? How is Austria training its future doctors and nurses?
In Austria, it's a little bit like in Nigeria's country. Fact is, doctors have to go to university for 6 years. Then after 6 years, the last year, the 6th year, is like a practical year. Then they go forward and have, for the specialized training, I think it's 5 to 6 years again. So for a specialized doctor in orthopedics or whatever. So I say after 6 years you are a doctor per se with a jus practicandi. You can work on yourself, but you are not a trained doctor in the sense of you can go out there and open a practice. So you have to stay in the hospital system. For nurses, it's 3 years, as a 3-year school, medical school. And after this, they go right away into the practice system, which also there's a big problem because that's the point where nurses and doctors technically and interdisciplinary don't meet and greet anymore. So doctors move on with the academic part of medicine, and nurses go right away into the practice part of nursing or caring, healthcare per se. It's a completely another situation with public health studies, because this is an absolutely new field of experience and education here in Austria. First public health they were all doctors, trained doctors, and they did it all in Germany or in English-speaking countries. Okay. So since 2000, 2005, this public health system per se, came to Austria. There are master studies, but they are very system-centered. They are not critical. So they are made for the sake of it. You can do it, you can add it to your name as a doctor, and then you are a public health specialist or master of public health, but you learned the system, how it works, without critical questioning it.
Okay.
And that's also one of the big problems right at the moment. Okay.
Got it. Yeah, thank you so much for that. The next thing that we're going to cover is the distribution. So we're going to look at how healthcare and health is distributed. And we're going to start with you, Nagira. So especially when it comes to the primary, secondary, or tertiary healthcare approach, what is the distribution in Kyrgyzstan?
The primary, so the distribution is like when the Kyrgyz Republic wrote the healthcare reform program. One of the main key point was to strengthen the primary healthcare service. Primary healthcare is it's a first point when the patient goes to medical doctor, and in Kyrgyzstan we have around 82 family medical centers, and we have felcher points in all this primary medical center is in the rural areas, in the wide rural areas, and the patient is then referred to the secondary care, which is then the hospitals. Which is the regional medical institutions. And patients cannot be referred directly to the tertiary care. In case of, for example, in case of crepes.
Cancer.
Yes, in case of cancer, for example, patients can be transferred directly to the national center. For example, National Center of Oncology or National Center of Physiatry, if it talks about the tuberculosis. And secondary care, there are territorial hospitals, regional hospitals, and the tertiary care is the national hospital and the national centers.
Okay.
Yeah.
Thank you. Thank you so much. What about Austria, Florian?
Yeah, primary, secondary, and tertiary system. First of all, the Austrian system is mainly based on this hospital centered, but this is historically grown right out of the universities, because the first big hospital all were connected to universities. So there is one in Vienna, one in Innsbruck, one in Graz, in the bigger capitals. Thing is, we now actually have 277 hospitals with over 24,000 doctors working in them. For this reason, we don't have had any primary health care as in other countries. It is now a very big topic, political topic here in Austria, how to integrate primary health care system and primary health care provision and supply in this hospital-centered system. Secondary supply is rather good. The support is rather fine because there are many private practices out there, but because of the insurance system, not everyone has a contract with an insurance to help people, and many of them are free doctors, or you can choose doctors where you have to pay extra. Okay. So if you visit such a doctor, he helps you and you get money back from your insurance, but only 18%, 20% go with the doctor. And this leaves us with another problem, that no one really needs primary healthcare, because this grown system relies on doctors who are working in hospitals, have private practices, and therefore can deliver their own, they can bring their own patients to their hospital and back to their practices. And here we have, I have to put this very serious, because in Austria it is possible for a doctor to open as much private practices as he wants. So if he works in and work in a hospital, so if he, for instance, is a chief physician, he can have 3 private practices, and this is, in my understanding, unethical, because this is a circle of profit. Yeah, and so no primary healthcare, but much secondary and tertiary.
Thank you so much. And Qatar, Maeve, what is Qatar's distribution?
In Qatar, yeah, the emphasis has been on developing a primary healthcare system, and the government have done this by they have 21 primary healthcare centres dotted around the country, just to serve the different locations. And it's a quite comprehensive service, offering curative and preventative care. They also offer ophthalmology, some radiology services, family health, dental, and anyone requiring more specialized care is referred to the tertiary system, and they're seeing an priority of urgency is prioritized, but waiting lists are as a result. Because of the incidence of diabetes, the primary healthcare centres are equipped to provide a lot of diabetic care as well. So it works quite well. The private system is different. You can enter directly into the tertiary level, but that's something that the Qatar Healthcare Professional Council is trying to regulate a little more, just to make it more efficient.
Okay, that's very good and very, I think, clear and concise regarding the system. Because we are going towards our 30-minute mark, I will do the next, I will ask you about the next 2 topics in one question. So I'll give you about 1.5 minutes to 2 to answer. Let's see if you can be, to the point and as brief as possible. So the question is, what works well and what doesn't work well for each of the 3 systems? And we're going to start these points with Florian and Austria. So Florian, what works well and what doesn't work well for the Austrian system?
Okay, both questions can be answered with changes. On the one hand, the system is so democratic and perfectly built that everyone can be absolutely sure that in case of need, he gets help, healthcare help or whatever. However, if there should be changes, it isn't possible, because there are always 2 opinions. Everyone has to be heard, and then it becomes a big political topic or issue, and then most of the time nothing happens. And so we are sitting and waiting until, yeah, everything cools off and is fine again. Changes on the other side also have the big pro that you can calculate with what is coming up. And right, actually, we are next big problems and topics are geriatric problems, so we can prepare for this. We know that this will come up in the next 10 years, and as there are no jumpy changes, we can develop strategies and processes how to help older people aging and living a fine life as long as possible. Yeah.
Okay.
Otherwise, yeah, that's it.
Okay, so changes for Austria. What about Qatar? What are the struggles and what are the things that give the system strength?
Well, what's giving the system strength is probably the supply of money, which is always the biggest problem in any public healthcare system. But it has been used well. Universal healthcare, it is available for everyone. So there's equality, which is a very, very important point, because there isn't equality in every public healthcare system in the world. The average life expectancy has increased from 61 in 1950 to it's 78 to 80, which is comparable with a global average. Maternal mortality has decreased. Vaccination coverage is at 100%. 100% of the population have access to clean water and sanitation. What isn't going well is there is not enough emphasis on prevention. As I mentioned earlier, the population is very young, but even though there is no burden of old age on the healthcare system, the non-communicable diseases are reaching epidemic proportions. That 40% of the population are obese, 20% of the population have diabetes. Yes, about 60 to 70% of the population don't engage in any physical exercise whatsoever. So the government have, for 2030, they have a vision which is basically more of an emphasis on prevention rather than curing. And they have conducted a stepwise WHO survey just to get an idea of where the population is at now and just to try and identify where the deficiencies are. And just to probably try and increase accountability in the healthcare system, because the costs are spiraling. They're spending 4.4 billion a year at the moment. That will rise to 8.8 with increased population, and they reckon maybe 40% of the population will have diabetes in the next 20, 30 years if current rates increase. So really, this is a preventative. This is preventative. So that would be where the failings are at the moment.
Okay, so on one hand side, a good finance system. On the other hand side, prevention should be a focus. And what about Kyrgyzstan, Nagira? What are the pluses and minuses there?
As Maeve said, in Qatar, there is no problem with financing, but accountability is a problem. In Kyrgyzstan, what went well, I mean, our government or the Minister of Health are trying to improve health system, and public health is quite new in Kyrgyzstan. So they are also trying and doing a lot of effort to improve public health system as well. And they're putting a much more attention on the primary health care in the rural areas. And the government is also trying to improve the infrastructure in these primary healthcare institutions. And the maternal mortality has slightly decreased, and the burden of tuberculosis has also slightly decreased. But despite all efforts of authorities and the support from the international organizations and donors, there are still a lot to improve and a lot to change. What is not working well is management system and financing. Still a very big problem. So as I already mentioned, the mostly primary healthcare system is depending on the external donors, and when they close their programs or when they go back to their countries, it will be a huge financial problem for the country to take over all support that has been done or given by the external funds. So the mainly problem is financing and management.
Okay. Thank you guys. Thank you guys for sharing. It's such a clear picture now on how is it working. And we are coming to the last question before we actually open up the panel to the audience. So now it's about the future and it's about planning. And the question here is there adequate planning between the public and private sectors to cope with the anticipated future demands? So let's start with Maeve. Is there planning involved? Are these systems looking ahead? What is happening in Qatar right now?
Qatar have identified that the cost will continue to spiral, and they are trying to encourage the public healthcare or the private healthcare system to play a bigger role. They've also started an insurance scheme to again offset the cost, where Qataris would be government subsidized for the Qatari nationals, and your sponsoring company would have a responsibility to provide you as an expat with health insurance. So that's the main aim for the next 20 to 30 years, is to increase the level of insurance. It falls at about 10 to 20% at the moment, so there'll be a drive to try and increase that, and just to try and increase the role of the private system within the healthcare system. So that would be the main thing, the
Okay.
insurance and the private system.
Thank you so much. Nagira, what about Kyrgyzstan's plans?
Kyrgyzstan's plans. Before I said that there were developed this national reform, health national reform programs after the collapse of Soviet Union, and now we are on the third stage, third health reform program, which is called Densolu. It is coming to the end in 2 years. And now the Minister of Health and health authorities, they are preparing for the next step, for the step 4, to develop a new health reform program addressing the sustainable development goals and fulfilling the sustainable development goals, and to address the issues that were not, or the lessons learned from the Densolu National Health Reform Program. And also the government is trying to develop, implement, and improve the e-health system, electronic health system, and coping private and state health institutions. There was a discussion about private and state health institutions to cope them from 2016. But now it is somehow frozen.
Okay.
Okay.
Yeah.
Okay, thank you so much. And Florian, your last take on Austria's plans.
Austria's plans are rather good. The strategies are fine, and the primary healthcare system is a big opportunity. However, here we are again with changes. One has to show the courage, the guts to just plainly do it. We have high quality trained doctors. The nurses are really, really top notch here in Austria. With delivering healthcare, and there are so many other healthcare professionals who do a great job. Unfortunately, the system is an after World War II system from the 50s, 60s, 1950s, 1960s. So it has, as Nagira says, go in the direction of e-health, go for geriatrics, changes in healthcare funding, so not only government and insurances, it has to come out of one hand. There are many things to do. The plans are there, and I guess the pressure, we have an oversupply system right now, and the pressure will come after 2020, 2025, when people really got that old and retire, and then there are more retired people than actually occupational work people.
Okay, well, there you have it. That was a dissection, let's say, of 3 different healthcare systems with their pluses, their minuses, their structures. And thank you guys for sharing so much information. I think that whoever has been listening can take a lot from this. Now it's time for us to see a couple of the questions that our audiences have asked, and Hugo was kind enough to forward me the questions. So bear with me while I just for a second go and see the questions here. Okay, so a lot of emphasis has been laid by different countries on training high-skilled staff, such as doctors, especially in developing countries. And these doctors are often not accessible to the very low-income earners, such as rural dwellers. What does the future hold for these individuals? What efforts are made for adequate bridging of the knowledge gaps seen in the community health extension workers who are the closest to these rural dwellers in the future? Did you guys understand the question?
I think this goes to me, right?
I think this goes to everyone. About primary health care and about the health service in the rural areas where people doesn't have access to the secondary and tertiary care.
Okay, so yeah, who wants to take a minute to answer this? What do you guys think?
Well, I think Qatar is quite lucky in terms of landmass. It is a small country, and the majority of the population live and have access to a primary healthcare center. So access isn't really an issue in Qatar because it's a small country. The population are quite concentrated in areas, and the Supreme Council of Health are quite strict in their timelines when it comes to presenting initially and receiving a diagnosis and treatment. So and again, small population, it's very easy to identify cases that don't meet these timelines. So in Qatar at the moment, access not an issue. The rural population is very small, and they are provided with a primary healthcare center.
Okay.
In Kyrgyz Republic is also the primary health care is strengthened and improving, and also in terms of medical practitioners in the primary health care centers, they are also motivated. So the government or Minister of Health, they're trying to motivate, to train them on a public health to work in the primary healthcare sectors. And so I hope that in the future it will be improving more.
Okay.
And for Austria,
yeah.
Yeah,
yeah.
it's short.
Go ahead.
For Austria, it's pretty simple because as in the city, also in the rural, in the countryside, we have those diseases of influenza that their people are somewhat over-informed via the internet. They know where to go, when to go, how to go. The only thing is they have to build up trust in their own possibilities, in their own power to change things for their own health, and yeah, empowerment. I think that's the big keyword.
Okay. Another question that you guys might have a go at it, well, in short, in a small island developing state with weak health legislations, how do you propose a well-rounded public health system from preventive to curative care? So just from your perspective, what do you think that they should do?
I think international guidelines. You know, if you adhere to the WHO international guidelines, I don't think you can go wrong. I know you're starting with a blank canvas, but WHO does have international guidelines when it comes to all aspects of care, and you experts as well. You just have to harness the knowledge of experts, and if needs be, you hire some expat workers like they've done in Qatar. But I think international standards provided by WHO is definitely a good start for any country.
For small islands, I would say it would be best to recruit doctors and healthcare staff right at the region or government or political area where they will work then. So go out there, recruit in villages, let them study, and then bring them back because they know the people, they know the culture, they know the language, and then you can build tiny healthcare networks. And even if they are just virtual, and you can build on networks, always better than on singular persons.
I completely support Maeve and Flo, and also in the small islands. I mean, they can go for behavioral change approach in terms of preventing diseases and to get better cure. This behavioral change will be also one of the options.
Perfect. Well, there you have it. We are actually close to the time that we had for this webinar. I would really want to thank you guys for joining us and telling the story of your health system. And I'm definitely sure that the people who are listening have had a lot of good insights in the 3 different health systems that you presented. Thank you for joining. Thank you for both Hugo and Chris for being in the background and helping us with the questions. And please don't forget to download the handout. It's the biography of the 3 speakers. And if there are further questions that you have, please let us know, and we can definitely support you in getting in touch with the 3 panelists. So thank you guys so much for being here. I hope you also enjoyed it as much as I did. And I hope to bring you back to have other conversations around the topic of healthcare systems and health in general.
Absolutely.
Thank you.
Thanks, Michael, for the great hosting. Thanks so much.
Thank you, guys.
Okay.
This has been a University of Roehampton London online live panel event. I wish you guys a good day ahead, and please join us in the future for 4 other events as this one.